You can't. So I think this came from a tribe member who might be in nursing school, or maybe they're a brand new nurse and they're just starting out. They're just realizing that this is a whole lot harder than they ever imagined, and those sicker patients actually have a lot going on, and they're trying to figure out how they're going to remember all these things. And I'm here to tell you that you just it ain't happening. Nobody's that good. You're never going to remember everything. I work with some of the most brilliant minds and some of the most talented nurses, advanced practice providers, physicians, surgeons. I've worked with them all. And nobody remembers everything. Not even the surgeon, not even the most on top of things doctor. It's not possible. So you have to try and remember as much as you can and utilize your resources. You should be able to find everything you need to know about your patient to take care of them safely. Are you going to remember everything? Probably not. To this day, I still carry around a piece of paper that is that gives me references for my patient and important or pertinent lab values. Every nurse carries around a different kind of report sheet. Every provider carries around a different kind of sign-out sheet. Everybody has a different tool that they use to remember things. And that's the point, is that you need to be an expert at utilizing the tools that are available to you. If you think that you're going to be able to remember everything about your patient years from now, when you've had years of experience under your belt, you're sadly mistaken. And I wouldn't think that anybody should expect that from you. And if anybody does, they're just flat out lying to you, and that's ridiculous. You have to know certain things. You know, if we're talking about a student and there's an exam or there's some kind of return skills demonstration, that's something completely different, and you need to study for whatever it is that you're testing for. But if you're caring for your patient at the bedside, or not even at the clinical bedside, you need to know enough information to care for them safely. And everything else you can either look up or have available to you. Do you need to know important lab values that are emergent or that are going to affect your patient's care? Of course. I mean, I'm not giving it a percentage, but you should know a majority of what's going on with your patient. Your assessment skills have to be on point. The key to being able to care for your patient is to have a good, thorough history of their medical history, but also what's been going on with them that brought them to wherever you are. The best nurses utilize their resources. It has absolutely nothing to do with how smart you are and how much you can stuff in between your ears and be able to spit it out from memory. It's about, I'll say it again, utilizing your resources. I may not remember everything, but I know where to look for it. I either write it down, or I have it on a piece of paper, or I have it in the patient's chart, or I've saved it somewhere, or I can look it up on the computer, or there's something that I need to know that I've saved on one of the apps that I have. I am good at utilizing my resources, and that's the answer.